not wait 3 months later, I'm not so sure whether the patient will survive, right? So for her to do MRI, just a scan, is 3 months later, okay, in a government hospital. So she was looking around for options. She's not so sure what to do. Thankfully, the FC knows me. So once connected the case, straight away I arranged for MRI to be done the next day. And right after the MRI come out, my doctor told me, wow, this one is a very big brain tumor case, need to immediately go for op, right? If not wait 3 months later, I'm not so sure whether the patient will survive, right?
Hi everyone, welcome to David Joshua Live Talk Show. We will talk about life and wealth, and today it is my pleasure to invite Marcus Sim, who is the co-founder of a healthcare concierge company called Select Medicare. And today we will talk about what he does and also what is his value in life. So I hope we can, you will enjoy this session. And thank you, Marcus. Hi, Marcus. Nice to meet you.
Hi, everyone. I'm Marcus, the co-founder of Select Medicare. I am a medical services consultant. In simple layman terms, I'm a tour guide for patients in the Singapore medical scene. I assist them, patients, on their medical journey without any hassle by connecting the patients to the respective insurance panel doctors and hospitals for treatment in a private hospital only. So this is from the patient's perspective. When you need help, there is someone behind the scene helping you, on the medical journey, telling you where to go, what to do, what to expect, what are some things you need to take note of when you are going to admit to a hospital for a surgery, for example. At the same time, I assist financial consultants in their job, right? I play a support role to them in the field of claims, both personal accident and integrated shield plan. And not only that, small things like underwriting cases, exclusions, loading, right? And ultimately, my aim is to bring clients and the consultants' relationship closer through my service, and ultimately to boost the advisor's competence in this area and hopefully help to bring their sales to the next level.
Okay, awesome, Marcus. It's my pleasure to invite Marcus, who is my go-to person for medical concierge services for my clients, and he's definitely a valuable partner. Thank you. So I met Marcus actually through LinkedIn, and I was very impressed with what he does as well. So today, before we start, I would think it would be interesting to find out who Marcus is. So let me start with a few questions for us to understand him a bit more. So Marcus, can you share about your personal journey and how it led you to this world of healthcare concierge services?
Because I'm doing this for about 3 years already, 3 years, 1 month to be exact. And now it's a world of difference due to the experience I have collected. So I started out meeting FCs. I always remember I only know 3 FCs, my close friends, right? So I actually shared with them. Back then, I also don't know what I was saying, but they were quite nice. They gave me some pointers on, how to give a presentation, how to pitch. Well, it was really a life-changing experience because I studied engineering, so I'm sort of an introvert. I don't really talk to people and all that, right? So I started cold calling consultants, right? So consultants cold call customers, right? So I cold call, FCs. I reach out to them on LinkedIn, IG, and I face a lot of rejection because some people thought I'm a scam. I even have one agent, I will not name him. Okay, so he posts online on social media to call out my company that I'm a scam.
Oh, okay.
Yeah, back then, 3 years ago. So, but I did not think too much. I actually just focus on the agents that want and believe in my service, right? And so slowly I help 1, 2, 3, 4, 5 consultants, case by case, and they realize they have benefited and they share my service and contact to their friends and colleagues in the industry, right? To those that require help for their clients. And in the blink of an eye, 3 years have passed, and today I'm too deep in this line to come up. So as I'm talking to you now, since 10 minutes ago, I have 3 cases that needs to go to the hospital. So I'm going to help the FC settle, okay, after this interview, right? One of them is a knee injury. One of them is a burn case from India. One of them is a kid high fever. Yeah.
Okay, so, very good. Yeah. I think what you share is very good, right? Wow, I can't imagine like 3 years really, like, how far you have gone. And I understand from you that you have, from 3 you mentioned, right? Now you have like probably 2,000 advisors that you have served,
Yeah, I think
right?
I spoke
So very
thousands of
impressive.
consultants.
But yeah, so like I'm very curious, right? Like what
Hmm.
does wealth means to you? Like when you do all these things, what is that journey for you, in your purpose in doing this? Maybe share a bit
Hmm.
more why you do
Okay.
what you do.
So the wealth to me is in terms of knowledge and experience in my field of work. Right. So
Okay.
because I take my job very seriously, so every day I deal with different problem, and no
Mm.
two patients are the same. Right. Two patients can have the same medical condition, but they have different patient types. Like, Enneagram got so many different types, right?
Yeah.
So it depends on who they are and how they are in a way. I have to learn to
Mhm.
handle them differently. So, and seeing different medical situations and how it plays out, okay, gives me the ability to advise the patient and agents in their current situation that they are facing. So,
Mm.
and it is more so, especially when I'm faced with a medical situation that myself personally, I have never dealt with before. I have to learn to improvise on the spot and find a solution for the patient, because, when people come to me, telling them I cannot solve the problem is not an answer, right? If not,
Yeah.
why do you even want to find me? Yeah.
Wow, I can
So,
really see your passion in your job, right?
right.
Yeah.
When I am able to solve a problem for the
Mm.
patient and the FC, it gives me satisfaction, right?
Yeah.
When
I think
people thank you,
Mhm.
yeah,
Yeah,
when
the
people thank you for
appreciation
the
that you
help,
get lah.
yeah, it's something that money cannot buy, right? When you
Wow, I
help them
like
at
that.
their lowest, and they will always remember you.
Wow.
Yeah.
Okay, very good. So like in sharing what you do, right? Like, do you have a community of people or people your age, right? That or maybe you
Hmm.
even work mix with people who are more mature that actually help you to shape who you are today.
I would think so, right?
Mhm.
People around me are, for example, financial consultants. I network with
Okay.
them, so I understand from their perspective, their work.
Mm.
Patients, sometimes I go down to the hospital, I talk to them. They can be from
Mm.
all walks of life, right? Some of them are
Mm.
even holding high position in certain companies.
I see.
Doctors, right? I network with
Mhm.
doctors. Okay, so
Okay.
clinic staff, nurses,
Yeah.
right? So everyone has a sort of different perspective of life, because they're in
Yeah.
different field of work. Yeah,
It,
so
se-
through
it seems
this,
like you
it
mix with more
helps.
mature people, huh?
I
Right?
think so. But of course, financial consultants is a big range. I have people that are
Yeah.
just RNF when they're 21 to I have served people that are 20,
Okay.
30 years in the industry also.
All right.
So
All right.
everyone is different. But I feel that,
Yeah.
in our line,
Mm.
everybody that you meet, you can learn something. Whether
Yeah.
is it, a direct information kind of thing, or is
Okay.
indirectly you pick up something from the person, you get to learn something.
Sounds good. So it seems like you are someone who has certain values in life. Maybe you want to share what is your value in your life?
Okay, so to
Mm.
me, I believe, because the nature of my job, I always believe in, being responsive, responsible for what I do, and we have to come from a perspective of, helping the person first,
Yeah.
right? Whichever kind of case that I get, my first thing is that I will always help you. Okay, I don't care whether, okay, so for example, sometimes advisors come to me, say this one is
Mm.
not my client, right?
Mm.
So I say it doesn't matter, because I will
Mm.
introduce as your medical partner for all your
Yeah.
clients. I don't care who the other party is, because
Yeah.
I want to help the advisor to make them look good in
Mm.
front of whichever customer that comes to me.
Yeah.
Yeah, so this is an example.
Okay.
I
It
how to
seems
say,
like
one
your
of my
value in
values.
life is really helping others, right? To be service oriented and also
Hmm.
be genuine in what you do.
Yes, correct.
Oh, very good. I'm very happy to have met you and hear your story,
Thank you,
right?
thank
Because
you,
many
thank you.
times we only see the face, right? And also, just to share with the audience here that I have also had two of my clients that work with Marcus, and I felt that he's very on the ball. And my clients had a very good experience as well, where he take care of them from the beginning to the end of the whole journey in from meeting the doctor for the first time all the way to the claims and check admission and also discharging. So very good job. Thank you, Marcus, for my two clients. I hope I have
Welcome,
more
welcome.
clients for you through a hospital plan. And
Hmm.
I've seen one of my clients that went to Bali and got hit by a surfing board. And what
Oh, wow.
happens is that she got a fracture on her nose and also a deep cut on her a chick. And during this period of time, being there for the client, I think is very important. That's why I believe in adding, value to my client through this as well. Right? Maybe can you share a bit more, right? Like how your service benefit individuals and families.
Okay, so this is from the patient standpoint, right? From the customer's
Yes,
point of view.
correct.
So I will explain a little bit more layman terms. I like to
Mhm.
explain the concept of a tour guide, right?
Okay.
When you go overseas to unknown city or maybe some rural area, you don't know what to expect. Okay, and activities to do, food to eat, attractions, so on and so forth. So you hire a tour guide to bring you around, and furthermore, if you're on a tour package, the itinerary is already arranged for you. You just have to go through the motion and follow the instructions of the tour guide, right? Ask you to meet at 5 p.m. at this place, you just follow only, then the bus will bring you to another place. So now we translate this concept to the medical field in Singapore. So my job, I'm the tour guide here, right? So I assist and help patients on their medical journey without any hassle by getting them the medical help at the shortest period of time in a private hospital.
Yeah.
And assisting and explaining to them on their claims, what to take note, what are some important things when you want to go for admission or when you go for consult, do I have to pay first, letter of guarantee, things like that, which doctor to see, where to go. Yeah. So to add on is because in today's world, I feel everybody likes to be serviced, right? But the patient benefit because they appreciate that someone is actually behind the scenes to take care of things for them. Even if things go wrong along the way, I will not run away, right? I am there to settle the problem for the patient.
Yeah.
Right? So with my help and assistance, they are sort of a private banking patient and not just a retail walk-in patient, because a retail banking customer and a private banking customer, the service is different. Yeah, so I like to use this analogy.
So I would summarize like you are a private banking kind of service to your clients, right?
Yeah,
Other than a mass walk-in client. So I think clients would definitely have a very burning question to ask, right? Like when they hire or they engage this service, is there any fees on their end or not? Right? Definitely.
No.
Yes.
They
Maybe
do not
explain a
have
bit
to
more.
pay me anything.
Okay.
Yeah, so the service is free for all the financial consultants and these patients to utilize. So as long as they have a financial, because I don't really do end consumer market patients. So do work with a FC that have this service, it is a value add to you.
Some of the success stories or cases where your services made a difference in someone's life and their health.
Okay, so many of these cases I want to share are A&E emergency cases where patient gets stuck at the hospital, accidents or kid high fever, they get stuck at the hospital, no beds, like kids, the parents always panic, right? So, because they walk in themselves, so end up waiting long hours without the bed, they go to their FC and the FC comes to me. So I help them to get bed in a private hospital, I transfer them. So what are some examples? Pain, bleeding, fractures that a patient need to wait 10 hours at the government hospital, appendicitis cases, right? Kid high fever, this kind of cases. Yeah. And one of the case I always remember, this is not an A&E case, right? This patient has a very bad headache for many months already. And he was seen in a restructured hospital. And the next appointment given for her to do MRI, just a scan, is 3 months later, okay, in a government hospital. So she was looking around for options. She's not so sure what to do. Thankfully, the FC knows me. So once connected the case, straight away I arranged for MRI to be done the next day. And right after the MRI come out, my doctor told me, wow, this one is a very big brain tumor case, need to immediately go for op. Right? If not wait 3 months later, I'm not so sure whether the patient will survive. Right? So I have many of these kind of cases. Things like heart cases also same thing, government tell him you come back 3 months later, but the patient just feel not right, and when wait 3 months, I don't know whether the patient can survive also. So these are some of the more memorable cases. Of course, I have patients that pass away, transfer already to private hospital, but they cannot make it due to old age or cancer. Mostly I pass away due to cancer. Last month I had one heart attack case, pass away also. Yeah.
So talking about cancer, right? There's this thing called the cancer drug list that was introduced recently, right? So how many people, how often people claim due to cancer in your experience, and what's the chances of the cancer drug list being the cost of it more than 5 times of the MediShield Life limits?
Okay. Cancer, I would say I mean, to me, because I see so many cases. So every other week, we'll usually have one. If not, every
Okay.
2 weeks, I have one or two. The most recent one being a breast cancer case that I did last week.
Okay.
So for when for end consumers, sometimes they ask about CDL and all. 5x, I think usually is not enough. I have
Okay.
patient having 5x only, and he realized that he did not have enough coverage. There's a little bit extra that he need to pay because it's not covered. So that's why it's important to buy rider, because
Yeah.
rider gives you the increase in the limit. 10 to
Okay.
15x, I think is roughly
Okay.
enough.
That's a
Don't
good
need
gauge.
20,
Yeah.
30x. Yeah, the 30x is like saying your claim
Yeah.
limit is 2 million, but how many people claim 2
Mm.
million a year? Kind of thing.
Yeah.
Yeah.
I think what you share is a very valuable insight that financial advisors can be educated and also to share with their clients. And can you explain the next point that to add financial advisors, how
Hmm.
collaborating with you can enhance their service quality and help with their follow-up with their clients?
Okay, so I like to share that I play a support role to the FC for their clients. I don't take all the limelight, right? I support them, right? So when their clients need medical help, or sometimes even themselves, they need help, right? I help them in terms of things like when their clients see a doctor, sometimes they forget to take their MC. I need doctor memo, I need referral to physio, my CI claim forms, I need this foreigner manual claim statement form to be filled. Why
Okay.
my check refund haven't come in, my e-file already, why the e-file got problem, why the MediSave CPF got issue, how come my why the hospital see my insurance is from, for example, NTUC, but I bought from Prudential, how come the system not updated, things like that. Okay, so that's why I
I
work
see.
hand in hand with the FC to support the client. And this is good because it showcases the value of the FCs to their
Okay.
client when they work with an agent that is able to provide this kind of solution to them and not just offer the plan. Okay,
Yeah.
to me, every FC in Singapore can sell the same plan. Okay,
Yeah.
but how many can say that they can provide a bespoke after-sale service to their
Wow.
clients when they need help, right? And in the financial advisory space, you have to ask yourself 3 questions. Okay, first question, as the advisor today, okay, today where it's so competitive, where is your competitive advantage
Yeah.
over another FC that does the same thing and sells the same plan as you? How are you different and where do you stand out? This is my first question. Second question, do you want to represent all the insurance company in Singapore or only the one that you can offer in terms of PA and Shield plans, right? So as of what I know, there is no financial consultant in Singapore that can represent all 7 Shield plans in Singapore. But when you know me, when you have Select Medicare services, technically speaking, you can represent all of the companies because you don't need to worry about the fine print. Although I'm not a financial consultant, but I know what is going on with every insurer, right, to be able to advise this group of patients. And the last question to ask, when a client inquires with you for a policy that you did not sell, okay, do you want to answer to your client, I don't know, it is better to check with your other agent, I did not sell you this plan? Or do you want to tell them, I'm able to help with this case, let me check for you, okay, let me provide a solution for you? And these are the cases that prove to be the most powerful because you did not offer the plan, but you come from a perspective of we help the client first. And okay, advisors tell me, I have one advisor, because I helped one case, he said, thank you so much, Marcus. Okay, because of your help. Okay, the patient never see any doctor, but because of your advice, it helped me open one case, my own personal case, right? So small things like this. So that's why in my service, I want to, forge a closer relationship between the FC and the consumer and the customer, right? Through my service. And this is what I hope to build for every financial consultant that know me in Singapore.
Wow, very impressive journey that you have been through. And I
Thank you,
definitely
thank you.
can see myself as a financial advisor who wants to provide quality service for my clients, to work with someone like you, to partner and give that hassle-free experience to our clients. Right. So I think that's all for today. And I'm really thankful that Marcus is here with us. And if you really like this content, I hope that you click like on the video. And if you love it, the content, the sharing from what we have today, please share with your friends, your clients, your colleagues and all these people. And also, please subscribe to this video channel if you really like the content, and share what are the other contents you'd like to see in the future. At the same time, I'll be putting Marcus' LinkedIn in the link, so you can check him out and reach out to him personally. And at the same time, any questions you have on any claims or what, please write in the comments below. We would love to hear from you. I would love to learn from you as well. All right, so that's all for today. Thank you for all your time watching this podcast all the way to the end. And thank you, Marcus, again for your time. And see you all soon.
Thank you very much.